My name is Jonathan Bowling. I'm a dermatologist from Oxford in the United Kingdom. Particularly fair-skinned individuals who've had a lot of sun exposure on the head, back of the hands. In time, there may be changes. An actinic keratosis is a change of the very top layer of skin, the epidermis, and the main cell there is called the keratinocytes. And what can happen is those cells can change in their nature, and therefore the development of red patches on the skin, but also red rough patches. So you may actually find that if you're putting your hand across your scalp, your temple, or the back of your hands, you feel a patch that is rough to the touch. And that can be a sign of an actinic keratosis. Often actinic keratosis occur in number because it's a field change, typically, because they're very common in areas that have had a lot of sun exposure. So just like fertile soil and a lawn with the odd weed cropping up, it's a bit like actinic keratosis. You may get multiple patches developing rather than just one individual patch. A good point to encourage patients is to actually feel their skin, so they can actually feel the skin, and if they feel an area that is rough to the touch, and it can feel like sandpaper. Additionally, sometimes with actinic keratosis you can get an increase in the amount of scale buildup, so a very small area but becomes keratotic, i.e. firm or hard to the touch. It can be an indicator of, again, a different type of actinic keratosis. Actinic keratosis affect the top layer of skin only, so they're not skin cancers, but what they are is an indication that your skin has had a significant amount of sun exposure throughout life. And we're not talking about sunburn last week to develop as actinic keratosis today. We're talking about throughout life. But if we see actinic keratosis on the skin, that can be an indicator that you have to be more careful going forward with regards to your skin, and also checking to make sure something different doesn't arise. So there are other types of skin cancer that can occur within fields of actinic keratosis. The main concern is a type of skin cancer called a squamous cell carcinoma, which can feel like an actinic keratosis, but typically has a few subtle features that are different. Firstly, it tends to be solitary, it may be tender, and may be larger, and if you feel it, it may have some substance at the base, so you can almost pinch this. But we don't want patients to wait for things to change to reach a certain size. If they have any concerns of something that is different on the skin, they should seek attention at that time. Undoubtedly, we have problems with regards to managing our population who are at risk of skin cancers because of the increasing population and relatively few dermatologists in the country. So what we're trying to do is to encourage GPs to take a more active role in the management and the prescribing and treating patients who have actinic keratoses. Treatment of actinic keratosis, there's a number of topical-based treatments, and they range from the very mild with very few side effects through to some topical treatments that work more effectively, but they have higher side effects. Now, it's from the GP perspective, you have to balance the expectations of the patient and whether somebody has just one lesion, in which case you may target a specific type of treatment, or if they've got lots of lesions but are very early in evolution, you may choose a different treatment. And so we would like the GPs to consider a range of treatments, and so they can treat the individual patient with the best treatment suitable for them at that time. Well, if we think that actinic keratosis are a sign of sun damage and people may have multiple, we don't have the resources to remove every single actinic keratosis, and nor would we want to, when we have very good topical-based treatments that can actually make them melt away and disappear without leaving scarring, and also without using the resources required for skin surgery. But importantly, if an actinic keratosis does show different features, where it's tender or is starting to grow and is behaving different to the background actinic keratosis, we would always recommend consideration of a diagnostic biopsy in that case to rule out skin cancer.